Hi guys, and welcome to Making It on Mondays. My name is Louise Jeffrey. I'm an acupuncturist and a coach, and I'm also your Making It on Mondays host. Now today we're going to be talking about 6 things you should know about the uterine lining and fertility and why they matter. Now I changed this from 8 to 6 as 8 was actually just ending up being way too long for a live, and I managed to consolidate some of the points so that you still got all the information. Now this is a topic that's taken from an article that our founder Jane Littleton wrote a couple of years back, and it's a very juicy topic. Now next week I will be talking about 6 things you can do to best support your uterine lining, as we don't have time today to cover it all. Today is the background, and next week is going to be the practical aspect, the how-to. Okay, so where do we start? Well, firstly, let's start by talking about what we know about the uterine lining. Now, we know that the implantation of an embryo in the uterus is actually a crucial early step in establishing a successful pregnancy. And really, what we're talking about here is the first few steps of life. Now, the reality is, there are some things we know about the implantation, but there's much that we actually don't know. Most of the information we do have comes from research that's done with IVF patients. And through this research, we actually understand that what applies to the implantation of an embryo in an IVF cycle also applies to natural conception. So if you're on here listening to this, it doesn't matter whether you're conceiving natural or trying to conceive naturally or going through IVF, the principles are the same. Obviously with IVF, you're just obviously able to kind of keep a closer eye on your lining and have a little bit of an idea of what's going on. Okay, so some IVF specialists refer to the inside of the uterus as the hidden frontier, because they believe that once an embryo is transferred to the uterus, all they can do is cross their fingers, right? And hope that something happens. But in actual fact, there's more that we can do to support the uterine lining. Now this scenario of not being able to fall pregnant is really frustrating, right? It's very frustrating for all fertility patients, but especially so for IVF patients who fail to establish a viable pregnancy, despite creating embryos that look good in the lab, right? So we almost feel like once we get to a certain point in IVF, we've done all the work, our embryos are great, and then we still don't fall pregnant. It can be incredibly frustrating, right? And a lot of fertility specialists will say that implantation is really all about the embryo. And I think the term they use is embryo driven. And even further, they'll often say that it's all about the quality of the egg and its aging chromosomes, in particular in women above the age of 37. But this theory suggests then that if you have an embryo that is genetically normal, then everything's going to work out great. But we know, sadly, that this is not the reality. And any of you who've been through IVF and who've still struggled to fall pregnant will know that, many women can have genetically perfect embryos, but they can still struggle to establish a viable pregnancy. So you might be surprised to hear that in most IVF clinics, only about half of the genetically normal embryos, that is those that are screened using, PGD or PGT, actually implant and go on to become a viable pregnancy. Sorry, I'm just making sure that just had a pop up on my screen. So only about half of the genetically normal embryos go on, to implant and become a viable pregnancy. So what's actually going on? This is the question, right? What's going on with the large number of genetically normal embryos which don't implant? Well, we've got a few ideas to share on this topic, and we're going to talk about that in a little bit more detail. But before we do, I just want to put a question out there and discuss this a little. The question is it just the lining that plays a part in implantation? Or can we blame a lack of implantation on a poor embryo or poor eggs? Well, this is a very, very good question. Now, the answer is, in some cases, yes, we can blame a lack of implantation on poor embryo or poor eggs, all right? Because it might be that these eggs don't impart enough energy to the embryo to keep it dividing and then implanting. But in many cases, the failure might be happening at the implantation stage. And it might be influenced by the all-important relationship between the uterine lining and the embryo. And we're going to have a look at some of those factors now, all right? So we're going to take a look at all of the factors that we know can have an influence on the uterine lining. And then next week, we're going to look at how we might be able to influence these factors. All right, sound good? I hope so. Because what we would love is to try and help all those genetically normal embryos who fail to get a foothold to have the best possible chance of becoming a viable pregnancy and of implanting. All right. So today, when we talk about these factors that influence the lining, we're actually going to take a slightly deeper dive into some slightly more scientific terms, but don't worry, I'm going to explain them all in detail. All right. So we've got 6 factors. Here is factor number 1 that makes the uterine lining more receptive. And that is the structure of the lining. All right. But more specifically, aligning with what we call a trilaminar appearance. So what does this mean? A trilaminar appearance. What does it mean to someone who's trying to get pregnant? Well, what it means is that the lining of the womb has to be adequately prepared for pregnancy before it can recognize and accept an embryo. And when a radiographer looks at an ultrasound of the uterine lining, they may, if they look closely, be able to see that the lining has a trilaminar appearance. And it's essentially, I can't actually show you a picture today because it doesn't give me the option to do so. But it's essentially where the lining has areas of 3 parallel type lines. Okay, so it's called a trilaminar appearance. And what happens is that the action of estrogen in the follicular phase, so the first part of your cycle, leading up to ovulation, estrogen stimulates the lining to develop until it shows this 3-layer appearance. And what we know is that this trilaminar appearance has been associated with better implantation rates in frozen embryo cycles. So if our hormones, such as estrogen, are adequate within a cycle, we're much more likely to have a trilaminar uterine appearance. Okay, so I hope that makes sense. Now, don't worry if you're a little bit confused or it's a little bit overwhelming, all of these terms that I'm using. I will share that amazing article that Jane Littleton wrote, and then you can read about this in a little bit more detail if you want to. All right, moving on to factor number 2 that makes the uterine lining more receptive. Another factor which is really important in making the lining more receptive is smooth contours. And what this means is that there must not be any structural impediments to implantation, all right? So we're looking for things like uterine abnormalities, such as polyps or fibroids or adenomyosis or retained products from an earlier miscarriage, right? And those of you who've had any investigative reproductive procedures, you might actually be familiar with some of these terms. But in Chinese medicine, we consider any of these impediments that I just mentioned to hinder the flow of blood, to interfere with the smooth contours, right? So to support our patients, we might use blood-moving herbs, for example, and acupuncture points, just one example, right? We're really wanting to make sure that when the uterine lining builds, that it has smooth contours rather than impediments to implantation, okay, what we call stagnation of blood. Okay, so factor number 3 in making the uterine lining more receptive is good blood supply to the deeper layers of the endometrium. All right, now, blood flow to the uterus, and particularly the endometrial and subendometrial regions of the uterus, really appears to be, beneficial or advantageous for implantation. Now, if in Chinese medicine we believe that a patient is blood deficient, in other words, that there's not enough circulating blood, then we're going to focus on improving blood flow to the endometrial lining using electroacupuncture and maybe some Chinese herbs, okay? So good blood supply to the deeper layers of the endometrial lining is really, really important, for implantation. Okay, factor number 4 in ensuring the uterine lining is more receptive is what we call a calm and chilled out uterus. Now, what does this mean? Well, what we know is that the frequency of uterine contraction, all right, in other words, the amount of times that our uterus and how regularly our uterus contracts around the time of ovulation, because we know that this increases around the time of ovulation, which is really possibly to assist the sperm in movement up the tubes. We don't actually know, but we're assuming that. These contractions that start to increase around the time of ovulation, they increase at ovulation and then they tend to calm down under the influence of progesterone, right? Just around the time of implantation. Okay, so they increase around ovulation because we think it's to do with assisting the sperm in moving up the tubes. But then when progesterone starts to kick in after ovulation and around the time of implantation, some 5 to 6 days later, we see these contractions normally calm down. All right, so that's really what we want to see, because we don't want to be having a lot of cramping around, around implantation time. But just to reassure you, if you do have some cramping around ovulation time, it's not unusual, however, for women who are having an embryo transfer and an IVF cycle to experience some cramping. And some cramping is okay, but what we know is that heavy cramping can actually hinder implantation a little, all right? So what we'd really want is a uterus that is relaxed and doesn't contract too much around implantation. All right, the next factor which is really important in making the lining more receptive is what we call a thick and juicy lining. Now, studies have shown that the uterine lining needs to be about 6 or more millimeters thick for successful implantation, right? And this requires not only the correct tissue structure, as I've mentioned before, all right, trilaminar and the contours, but also that the right receptors and some other factors that we don't even know about yet are available and around, okay? But again, what is really important in this factor is the right balance of hormones. So if you're going through an IVF cycle and at your scans, and this is where it's great when you're going through IVF, because you can actually ask the radiologist or the specialist who's doing the scan what the thickness of your endometrial lining is. Now, we know that most IVF clinics like a lining to be above 7 or 8 millimeters for them to be confident in it. Some specialists will say 6 or more millimeters thick. Anything from sort of 6 or 7 and above is good. All right. And then I'm just going to move on to the next factor. And I just want to touch on this briefly because I think it would be remiss of me not to go into a little bit more detail about hormone levels and the lining and how the hormone levels influence, our uterine lining. Now, you've heard me say that we need optimal levels of estrogen to prime or stimulate the growth of the lining, right? But we also need optimal levels of progesterone to maintain that lining, all right? And to maintain it through the early weeks of pregnancy. And we also need progesterone to ease the contractility of the uterus during the implantation window, right? And in some IVF cycles, the levels of these hormones are sometimes suboptimal. In other words, they're not ideal. And they may not be as high as the levels that a body experiences during a normal menstrual cycle. And this is why some IVF clinics prefer to transfer frozen embryos during a natural cycle into a natural environment, right? Because your body is producing the hormones on its own, and often it's getting them up to the level more easily than it would in a stimulated or IVF cycle. So for women who are trying to conceive naturally, making sure that the ovaries are functioning well is really important, because this will usually ensure that your levels of estrogen and progesterone are optimal for creating the uterine lining conditions that it's going to promote implantation. And if you want to know how to get your ovaries functioning well, chat to your Chinese medicine practitioner about specific acupuncture protocols that we use to support the first part of your cycle. All right, and then finally, because I realize that I'm nattering on a little bit and I'm going a little bit over time, I'm just having a check what my time is. Yes, a little bit over time. I've got a couple of minutes left. Finally, our last factor in ensuring the uterine lining is more receptive is a friendly immune environment. So the immune system plays a really crucial role in whether or not an embryo is going to successfully implant. All right. Now, autoimmune diseases or other subtle imbalances in the body, all right, really have an influence on the immune regulation of the uterine environment, right? And they can have a large impact on an embryo's attempt to implant. For example, when we see elevated uterine levels of certain immune cells, such as natural killer cells or activated T lymphocytes, these have been shown to impede successful implantation, all right, to hinder it and to impede the establishment of a viable pregnancy. Then on the other hand, And just to give you the other side of the coin though, the actions of some T lymphocytes and NK cells are actually necessary to promote a favorable environment for implantation, right? But there are certain immune cells, certain NK cells and activated T lymphocytes which are not great. It's really about getting the balance right. So if you suspect that you have NK cells or perhaps some sort of immune issues that may be impacting your uterine receptivity, then make sure that you go and see your fertility specialist and they can run some tests for you. And they can, if they find that you have a positive, that you test positive to NK cells, you can utilize certain medications within your cycle to help with that and to help with implantation. We also, in our clinics, we also use some Chinese herbs to support women who are diagnosed with immune issues, but it's really important that you chat to your specialist as well, should you be concerned about this. All right, so to summarize, factor number 1 that makes the uterine lining more receptive is the structure of the lining, more specifically trilaminar appearance. Number 2 is smooth contours, which is a lining mostly free of structural impediments. Number 3 is good blood supply to the deeper layers of the endometrium. Number 4 is a calm and chilled out uterus, so one that doesn't contract too much during implantation. Number 5 is a thick and juicy lining, so adequate blood flow to the uterus. And number 6 is a friendly immune environment. So as you've heard today, as I've talked on this topic, the uterine lining is really quite a complex and fascinating topic. Well, I think it's fascinating. But I really hope that you've enjoyed, taking a little bit of a deeper dive into it. I hope that you've gained a little bit more understanding about your own body. Today was really about setting the stage. And next week, we're going to be talking about what you can do in practical terms to improve the receptivity of your own uterine lining. So I hope that it was interesting. That's it from me for today. Please let me know if you have any questions about this topic. I'm sorry that it's not live, but feel free to post any questions and I'll make sure that I answer them. And I will also be posting the link to the article that was written around this topic, which goes into quite a bit more detail, which you can then read if you, if this has piqued your interest. Anyway, I hope you have a beautiful week. If you're in Sydney, at least the sun is shining. It's so nice to see the sun is shining. I know it completely picks up my mood. Hope you guys have a beautiful week and I will see you next Monday. Bye for now.